Hi, my name is Beth Strader, and for my argumentative, persuasive research presentation for HLIF 515, I did New Zealand healthcare system compared to the United States healthcare system. My argumentative thesis statement states, the New Zealand healthcare single-payer system provides better medical opportunities for their citizens compared to the United States multi-payer healthcare system. So to get started, we're going to look at New Zealand healthcare coverage. New Zealand healthcare coverage is a universal healthcare coverage. It's mostly public funded, but regionally administered delivery system. The services covered include inpatient, outpatient, mental health, long-term care, prescription drugs, and its general taxes finance most of the services. The national government sets an annual budget and benefits package. Patients owe co-payments on some services and products, but no deductibles. Approximately 1/3 of the population has private insurance to help pay for non-covered services. District health boards are charged with planning, purchasing, and providing health services at the local level. The New Zealand healthcare system, no citizen can be denied treatment in public hospitals. All citizens have insurance through government-funded, universally acceptable health services. In practice, coverage varies depending on income, need, location, and type of service. The role of the government. They set an overall budget and benefits package, which is based largely on political priorities and health needs. They also set national requirements for publicly funded services, which are to be implemented by 20 geographically defined district health boards. The district health boards consist of 7 locally elected members and up to 4 members appointed by the Minister of Health. The key national entities. The first key national entity is the Ministry of Health, which has overall responsibility for the health and disability system. They act as the Minister of Health's principal advisor on health policy and maintains a role as funder, monitor, purchaser, and regulator of health and disability services. The Technology and Digital Services is a business unit within the Ministry of Health. It's responsible for implementing the government's digital health strategy and other e-health initiatives. The Capital Investment Committee, which is a Ministry of Health subcommittee, advises on matters relating to capital investment in the public health sector, in line with the government's service plans. Health Workforce New Zealand leads and supports health and disability workforce training and development. New Zealand Health Partnership, owned and supported by New Zealand's 20 district health boards, is tasked with helping the boards pursue bulk procurement of medical equipment, devices, and services. The Pharmaceutical Management Agency of New Zealand assesses the effectiveness of drugs, distributes prescription guidelines, and determines the inclusion of drugs on the national formulary. The Health Quality and Safety Commission is working towards New Zealand's version of the Institute for Healthcare Improvement's triple aim: improve quality, safety, and experience of care, improved health and equity for all populations, and better value for public health system resources. The Health Promotion Agency develops and enables health promoting policy, initiatives, and environments. The Health Research Council invests in a broad range of research on issues important to New Zealand. If you look at this next graph, this is the organization of the health system within New Zealand. You can see the Minister of Health appear in the center, and then you can see all those different entities that we just talked about spread throughout this graph. What you would find interesting here is that if you look at the arrows, they have back and forth arrows, not just one-way arrows. You can tell it's a large governing body that's working together for the same purpose. Over here on the left, you can see private health insurance and where it fits in. And again, only approximately 1/3 of the New Zealand population has private health insurance. The role of public health insurance, which within the New Zealand healthcare system, is available to all permanent residents. It's publicly financed through allocations of pooled general taxes, and there's one exception. Accidents are covered by a no-fault accident compensation scheme. The total health spending was 9% of the gross domestic product in 2018. Public health insurance covers preventative care, inpatient and outpatient hospital services, maternity services, physical therapy, dependable medical equipment, long-term care, home health, hospice care, mental health, dental care for school-aged children, inpatient and outpatient prescription drugs, and disability support services. The role of private health insurance. It's offered by nonprofits and for-profit companies. It accounts for 5% of total health expenditures. It is mostly used to cover cost-sharing services, elective surgery in private hospitals, and private outpatient specialist consultations. It ensures faster access to non-urgent treatment, and it is purchased by the individual. Cost sharing and out-of-pocket spending. It's paid directly by private households. The largest portion is outpatient services. There are no deductibles in the public sector, but co-payments are still required for primary care visits. There is no limit on the amount of co-payments, but the New Zealand government has capped co-pays at $12 for 1/3 of the low-income population for the New Zealand residents. Otherwise, co-payments vary from $10 to $34. So on this slide here, you can look at typical patient co-payments and safety nets. So if you look at the service for primary care visit, you have a range for how much your co-payments would be for adults under age 65 on the fee per encounter. And if you look under maximum out-of-pocket costs per year, you can see there's reduced co-payments for high users who apply for high-use health cards, low-income adults like we talked about, adults age 65 and older, and then New Zealanders in the designated low-income areas. You can see how much fees for specialist consultation. There is none for the outpatient for public hospitals. There is none for hospitalization for public hospitals. And for prescription drugs, it's based on a national formulary, which is about $3.40 of a copayment for prescription drugs. So now let's look at the United States healthcare coverage. So United States healthcare coverage, there's no universal health insurance. 92% of the population had coverage in 2018, leaving 27.5 million, or 8.5% uninsured. In 2018, 55% of the population was covered under employee-sponsored health insurance. In 1965, first public insurance programs were introduced, Medicare and Medicaid. Medicare is a right to health care for individuals aged 65 or older. Also, individuals under 65 with long-term disabilities qualify, and individuals with end-stage renal disease. For Medicaid, which includes 17.9% of Americans, is health care for low-income families. It is also available to the blind and those with disabilities, and pregnant women and infants. Another federal program is the Children's Health Insurance Program, which covers 9.6 million children. It's available to low-income families that earn too much to qualify for Medicaid. If you look at this chart here, this is the organization of the health system within the United States. you will see you have two different categories. You have public funding and private funding. And if you compare this to the New Zealand chart that we was seen earlier, you can see on the United States one, there is a lot of one-way arrows. It starts from the top and then just works its way down. There are not a lot of entities working together or services all working towards a common goal. So you look how simplified the United States healthcare system looks because it's very individualized compared to the organization of the New Zealand healthcare system. How you can tell everybody is working together within their one system. Back to the United States healthcare coverage. The role of public health insurance. Medicare is a combination of general taxes, which are mandatory payroll tax that pays for Part A. Medicaid gets its money from two-thirds of its money of costs from federal tax revenue. And the CHIP program is funded through matching grants provided by the federal government. The role of private insurance. It's accounted for 1/3 of total health expenditures. Primary insurance for 2/3 of Americans. Most employers contract with private health plans to administer benefits, and they cover their employee and their dependents. And then more than 1/3 of Medicare beneficiaries opted in 2019 to receive private Medicare Health Advantage plans. And as we learned about in class before, Medicare Part A and B and D are very expensive, that you need Medigap, which would be a private insurance to cover for the additional costs of Medicare. Services covered. There is no nationally defined benefit package. Covered services depend on the insurance type. The ACA, or the Affordable Care Act, requires individual marketplace and small group plans, less than 50 employees, to cover doctor's visits, emergency services, maternity and newborn care, and rehab services. Cost sharing and out-of-pocket spending. Out-of-pocket spending accounted for 1/3 of total health. The average for a single person to be covered for health insurance each year was $11,172. The out-of-pocket spending for dental is about 40% a year, and the out-of-pocket spending for prescription drugs is about 14%. Now let's compare New Zealand to the United States. So the life expectancy in adults for New Zealand is 81.4 years, compared to 77.3 years for the United States. Healthcare in New Zealand is 100% publicly covered, with 33% of individuals having private complementary insurance. Compared to the United States, 34% of the public is covered, 67% is covered through private insurance, 15% is covered through multiple insurance. That's where we talk about the Medicare and the private insurance. And 8.5% is uninsured. The cost per person for healthcare in New Zealand is $3,923 compared to $11,172 in the United States. The wait times for elective surgery in New Zealand are up to 4 months, and in the United States they are 11 days. The suicide rate in New Zealand is 11.8 per 100,000 individuals, compared to 13.93 per 100,000 individuals in the United States. The gross domestic product of healthcare is 9% in New Zealand, compared to 16.8% in the United States. The infant mortality rate is 3.9 per 1,000 in New Zealand, compared to 5.6 in the United States. Obesity is higher in the United States at 30.6, compared to 20.9 in New Zealand. And interesting enough, the number of physicians is 2.2 per 1,000 compared to 2.3 per 1,000 in the United States. Even though the population size is much bigger in the United States, there's still about the same amount of physicians for care. So what is the future model to improve healthcare in the United States? We need to increase healthcare access. We need to enact universal health coverage, increase preventative care, and decrease cost of prescription drugs. And if you look at the increased healthcare access and increased preventative care, and we go back to the chart we just looked at, if obesity, possible suicide rates, and then life expectancy could increase in the United States if we enacted increased healthcare access, increased preventative care, and universal healthcare coverage, along with decreasing cost of prescription drugs. Is universal access achievable for all? Yes, because if everyone currently has access to the emergency room, then they have access to healthcare. As a healthcare system, we need to make hospitals, clinics, physician offices more accessible by offering more services in that area, increasing incentives for healthcare workers to certain areas, and decreasing the cost of services. Are there any ethical issues that need to be resolved? Yes. Access to care. Currently in the United States, there are 8.5% of the population who is uninsured, thus leading this population to two options: use the emergency room as medical care for all needs, or no medical care. By not offering universal health care coverage and access, as a country, we are determining who should live, the quality somebody should live, and like HLIF 515 has taught us, that race, income, and occupation are more important. So based off of the slides that we just went through, comparing New Zealand and the United States healthcare system, you can see that the New Zealand single-payer healthcare system provides better medical opportunities for their citizens compared to the United States multi-payer healthcare system. This is seen by looking at all the key national entities working together to form a common goal and interacting with each other back and forth through communication. This is also seen within the statistics of life expectancy, decreased suicide rate, decreased obesity, decreased infant mortality. If the United States could do a better job communicating and setting national standards, increasing healthcare access, increasing preventative care, enacting a universal healthcare coverage, and decreasing the cost of prescription drugs, then they would do a better job for their population and for the individuals in their country. But at this point in time, the New Zealand single-payer healthcare system is better compared to the United States healthcare system. These are my references. And if you have any questions, please let me know. Thank you.